Welcome back to Another Thing. I'm Larry Menti. Healthcare-associated infections affect hundreds of thousands of people every year and kill tens of thousands of people. The major question is why and what is being done about it. To answer those two questions, Susan Hanrayan is an infection prevention manager at Jersey Shore University Medical Center. Thank you so much for being here.
You're welcome.
Those numbers are staggering.
They are staggering, but there's lots of strategies that healthcare facilities are taking to ensure the safety of patients and to reduce and eliminate healthcare-acquired infections.
What can be done at the hospitals, and is it being universally done?
So hospitals are following what's called bundled practices, and bundled practices are a collection of evidence-based data and best practices that enable clinicians and nurses to deliver safer health care to the patients, and making sure visitors are aware that they are part of this protection of the patient as well. They should be washing their hands and wearing gowns.
I've heard this several times now, that visitors are often the ones that spread the infection.
Well, they certainly are a component to healthcare-acquired infections because you do have the potential to bring pathogens into the facility and make our patients sick, make the care providers sick as well.
Is there something you can do to help prevent infections?
My professional organization, APIC, has put together a program called Infection Prevention in You. And it's an educational program that encourages patients to ask the questions of their providers. Ask a physician or a nurse to wash their hands. Ask them why this indwelling device in their body has to stay in, and for how long does it have to stay in. You know, ask about the cleaning and disinfection processes in your hospital room.
But these are such basic things. Why do we have to assume that's not already being done?
Anytime you have large groups of people under one roof receiving medical care, there's always going to be the potential for infection and pathogens to spread. You know, these are microorganisms. They're 2 microns big in size, and they easily adjust to their surroundings.
And the CDC said that in 2011, 75,000 people died from these infections. And yet you hear about West Nile virus, you hear about all these other things in the news that get a lot of coverage, and they kill a handful of people. Why would you like to see this get more attention than it's getting?
I think it deserves more attention out in the public, so that's why we encourage you to be an advocate, to be a knowledgeable consumer.
Is there a database that people can look at? Can they go find out if a hospital has had a problem with this in the past?
Sure. Hospital infection data is completely transparent. There's the hospital report scorecard, which is posted through the Department of Health on their website. We have to report our data into the CDC national database, and that data then becomes transparent through either Department of Health or CMS websites. We are encouraging people to see the good work that we do, and we are encouraging people to know our rates and to understand that they are safe when they're coming to our healthcare facilities.
You were wonderful. I know you came here to talk about MRSA, which is just one of these infections, but after talking to you, we expanded the topic, and I think it's important we did. MRSA does get some attention because it's one of the worst pathogens that you deal with, but there are many others out there. Thank you so much for joining us today. Susan Hanrayan, Infection Prevention Manager, Jersey Shore University Medical Center. Still to come, it is the new year, and I know you want to eat healthier, but it's so hard to do. Have no fear, Dawn is up next to help you out when Another Thing continues.